Okay, so today's lecture is about endometriosis, and it's quite interesting because endometriosis is one of those subjects people don't like talking about because it can be sexually transmitted. If a man has endometriosis, the woman can get it. And I need to tilt that just a little bit.
If the man has it, it's transmittable?
If the man has it, the woman can get it from him.
How does he get it since he doesn't have... Yes.
Well, here's the interesting thing. People think that, you know, all of life is easy and very explicable. But what I found is life is more interesting than we like to think. And things can be passed on generation to generation. You can get parasites from your mother, and they can cause endometriosis. I've had girls who've never had sex get endometriosis.
I did before I had.
Yeah, and usually it's because you get it from your mother when your hormones turn on and your uterus starts ovulating and you start having periods. The endometriosis shows up. Oh, okay. This is stage 1 endometriosis on what they call an H&E stain. I don't expect you guys to know what that means, but all of this is abnormal tissue, growing endometrial tissue, and this is actually from outside the uterus. Usually it ends up being on the tubes first, and it causes what they call adhesions, which are little pieces of tissue, scar tissue, that adheres the different tissues. Now this is a stage 2 endometriosis, or mild they call it, but any stage can cause a lot of pain and a lot of problems. And as you see, these are like filmy adhesions going from the uterus to the peritoneal cavity. The peritoneal cavity, the peritoneum, like when people rupture their appendix, they get peritonitis, can kill you. Well, these adhesions can go from the tube to the peritoneum, from the uterus to the tubes, and it starts binding them down. And there's nerve fibers, pain fibers, in the peritoneum and in the tubes and on the uterus, and these pull on those all the time, and people can get really bad pain, or they can just get mild pain or no pain at all. I've met women who have severe stage 4 endometriosis and they have no pain at all, which is the only thing they had was infertility. So this is scar tissue, and in stage 1 it will only go from the uterus to the tubes, or from the tubes to the peritoneum. Stage 2, somebody did this, you know, has anybody been down to the Bodies down in Las Vegas?
I have.
It's way cool. They have all these Chinese prisoners that they literally strip their skin off, and you can see inside their body, and they have different things. But this is the uterus, and it's kind of interesting because this is the vagina, this is the cervix, the bottom part of the uterus, and this is more vaginal area. This is the anterior cul-de-sac, posterior cul-de-sac, and this is the body of the uterus, and they call this the neck, and this is the cervix. And in stage 2 you can get filmy adhesions from the tubes to the uterus, showing endometriosis on the ovaries. That's actually stage 3. So in mild you only get the little adhesions, and the uterus has layers. There's the outer part of the uterus, and then there's the myometrium that has the muscle that helps contract the uterus during labor. And then there's the endometrium, which is filled with blood vessels and tissue that helps feed the fetus, the placenta, and get the nutrition to the fetus. Now, when you get endometriosis, that inner part somehow gets outside the uterus. And most doctors, they say, oh, we don't have a clue how it happens. You know, maybe they have retrograde menses, which means that instead of going out through the cervix and out through the vagina, it goes out through the tubes and brings endometrial tissue outside. I'm here to tell you these have little cilia that move stuff down toward the uterus. It doesn't move stuff out of the uterus. So something must get in there and move it out for them, and I believe it's parasites. Okay, so stage 3 endometriosis. See how these adhesions, they're not just filmy, they're thicker, and they look kind of yellowish, and they can have other stuff inside of them. This is a picture, a live picture of inside the uterus. I used to do this surgery, and let me tell you, it was quite crazy surgery, and you never knew what you were going to get because, you know, you have these women, you do an exploratory laparoscopy, or you do a laparotomy where you open people up, and you'd look inside, and a lot of times you'd look in and you'd go, oh, this is too bad, I wasn't ready for this. You know, I only scheduled for 20 minutes in the surgical suite, and literally something like this would take you 3 to 4 hours, maybe even 6 hours to clean up everything. And so you'd get a diagnosis, stage it, and then go do the extensive surgery. This is quite interesting. This is a big old cyst of blood, and they called them chocolate cysts because if you opened them up, it'd be old brownish looking blood, and that's why they called it chocolate. And what would happen is the adhesions would grow around it, and I believe these cysts are because our body walls off the parasites, and they would have a lot of blood in there and all kinds of stuff, but it would cause infertility because this could even enclose the end of the tubes, so you wouldn't even get any eggs down in the tubes at all. Stage 3, moderate amount of disease in extensive places around the pelvic cavity. So you'd get a little cyst here and adhesions there, and the fallopian tubes would be all closed up, and this is stage 3. And then stage 4 would involve the ovaries, and literally would scar up around the ovaries, making it so the ovaries would try to ovulate, but the egg had nowhere to go, so you'd develop these cysts, and the parasites would eat up the eggs anyway, and they'd be all over the place. So the endometriomas, they call them, when they're outside the uterus. Inside the uterus, it's just the endometrium.
So
it's normal.
How is that related to what my Cindy has? You know, you've treated her with the cysts. Does she get cysts? She has to do parasite cleanses all the time.
She has. I would say with 100% confidence she has endometriosis. If she went to the medical doctors, they would do surgery on her, and quite extensive surgery. But we've kept it at bay doing parasite cleansing. It's so interesting. When I started out as an OB/GYN, I was doing this surgery, and I actually became a very adept laparoscopist. I would treat this with laser and you know, these little roller balls that you'd put on the laparoscopes, and we just do little incisions, because before that time you'd open women up, you know, a big old open you up and then try to get out the endometriosis. But with the laparoscopy, you could see that you could use microscopic telescopes with the laparoscopy, and you could see all of the little pieces of endometrial tissue that was outside the uterus, and you could laser it with argon lasers and different things that would heat up that tissue, kill it, and then you'd go back in, look again, and if there was any areas growing or left, you'd do it again. But laparoscopy changed the way we treated this, because it was much easier to see even the microscopic areas, which there was a lot of. And it was fascinating, because I worked under a Dr. Davis down in Phoenix, and he wrote the books on endometriosis and infertility. Go ahead.
What was your first name? Was it Greg?
Might have been.
He was my doctor for endometriosis in California at one time.
Oh, wow. How many years ago?
Let's see. About 15 maybe.
Okay. Yeah, he was, what university was he associated with? Was it UC Davis
Yeah,
or?
it was UC Davis.
Yeah, that's him.
Yeah.
Yeah, I trained under him. And he was like amazing. And so I became amazing because I trained under him. And at that same time, I developed malignant melanoma. And here I was doing laparoscopic surgery, and I have melanoma, and I've got a great career ahead of me because, I mean, these docs that knew how to do this made big bucks because they could go in, fix the problem without causing a lot of trauma. And anyway, I got my malignant melanoma, and I was dealing with a lot of women with endometriosis. And I weighed 260 pounds at the time, and treated my malignant melanoma with parasite cleansing, Esiac tea, cat's claw, chelation therapy, and I lost within a matter of two and a half months 40 pounds. And all of the women in my practice, you know, they were coming in with endometriosis, and most of them get overweight because when you're in pain all the time, you tend to eat. And you're feeding parasites too, by the way, because they make you hypoglycemic and make you want to eat. And so anyway, I was treating this, and all the women were going, Dr. Werner, how you lose weight? We want to lose weight too. And then I was like, oh, I'm doing a parasite cleanse. Well, we want to do that. So I would put them on the same parasite cleanse, and in the process, you know, I was diagnosing endometriosis. I would schedule a surgery. They would go into surgery with really severe endometriosis diagnosed with the laparoscope. I'd take them into surgery and it'd be gone. And I was like, what in the heck? This is strange. And all I was doing differently was doing parasite cleansing in between diagnosis and then the main surgery. I'd get in there to do surgery and everybody was like, well, Dr. Werner, where is the endometriosis? I'm like, well, I gave him a parasite cleanse, but I don't know if that got rid of it, but it's gone. And so I consistently had cases where I had diagnosed endometriosis, and we had videos, we had pictures, and then we'd go in and it would be gone, and I'd show these to the other laparoscopists, and they'd go, well, you better stop giving them parasite cleanses.
It's not really.
And I was like,
We're losing money.
what? You know, because we were losing money. We'd get in to do this massive surgery scheduled 5 to 6 hours, and there was nothing there. So we just went in, looked, it was gone, and we'd go, oh, spontaneous healing, spontaneous regression, you know. And came to realize, because this happened so many times, that the parasite cleanse was cleaning up the endometriosis.
What type of parasite cleanse were you doing?
We were doing Hulda Clark's, because that's the one I used.
She gave you right up front, huh?
Yeah, that's the one I used for cleaning up my malignant melanoma, and that's the one I was giving these women to help them lose weight. They'd lose weight and they'd lose their endometriosis. So, stage 4, the endometriomas are on the ovaries, and this is a statement from the surgical laparoscopists. They say they must be removed surgically because hormonal treatment alone will not remove the full endometrial cyst. Now, I tell you, I had women with cysts, they had lesions, they had chocolate cysts, and we'd go in and they would be gone. And yet, they were telling us, you have to do surgery on this. You have to do surgery. And endometriomas, sometimes misdiagnosed as ovarian cysts, which occur normally within the reproductive cycle, but let me tell you, we would find all kinds of cysts. Sometimes if they'd rupture, they'd bleed inside, and that would cause a lot of pain, and it would cause, you know, abnormal bleeding through the vagina also, but sometimes no bleeding at all, and yet you'd look in there and they'd be full of blood because some of these cysts would rupture. So quite interesting. So this is the stages. This is minimal. It's mainly, you know, just on the uterus and a little bit on the tubes. Stage 2, mild, can get a little bit, elsewhere. Stage 3 gets more, and stage 4 gets even worse. This is a comparison, it's a drawing by a medical artist. This is a chocolate cyst, this is an ovary. These are a bunch of adhesions and stuff growing on the uterus. And this is the normal stuff. And this is a little depiction of where it can occur. And it would go and start growing on the intestines, which eventually it would make and go through and cause peritonitis, which is where you get all the bacteria from the colon into the sterile cavity of the belly, and it would, it could kill people.
Did it take you a long time to finally decide that the parasite cleanse was doing some good?
Oh, I recognized it fairly quickly.
You weren't quite ready to.
But all of my my colleagues kept telling me, you're going to get in trouble. You've got to stop blaming things on things that don't exist. They didn't believe in parasites.
That's the medical story.
Yeah. And so it was quite interesting. Now this is a treatment. This is showing the WO oil, the wormwood, the cloves, the black walnut, the plant enzymes, and the tetracleanse. Now, let me tell you why I use these things. The WO oil literally helps the parasite cleanse penetrate deeper in the tissues, including the brain and nervous system, joints, you name it. So I like using the WO oil, but you only have to just touch your tongue with it. TT means touch tongue. So, but I found you have to do it 4 times a day to be the most effective, because it only lasts about 6 hours. So you do it morning, lunch, dinner, and bedtime. The black walnut, we have the sheet. You do that morning, lunch, dinner, and bedtime. The cloves are morning, dinner, and bedtime. The wormwood is just once a day. That wormwood is so powerful when you take it. I can only get up to 8 capsules. I've been taking it for years and years and years, and I've become very sensitized. When I get up to 8, actually up to 9 capsules, I get the worst stomach ache because it's so strong in my system. And you only take it once a day. So I've kind of either been dividing the doses into 4 in the morning, 4 at night, and then I don't have any problem, or just take 8 at a time, because sometimes I forget to take it just once.
And when you get to 14,
the 14.
That's the last day on the.
That was the recommendation from Hulda Clark, to go up every day, clear up to 14 days, 1 additional tablet each day. And it's only been the last 4 years that I've had to limit it to 8 capsules. Now I can do 6 in the morning, 6 at night, but if I get above 8 capsules, my stomach just starts really hurting. And I don't know if that's because I got a bunch of stomach parasites, who knows, but it does hurt. Plant enzymes are unique in that they have proteases, lipases, amylase. They've got all of these enzymes that actually go in and dissolve some of these adhesions, and they dissolve the capsule around the cysts, which is kind of neat, because then you don't have to go in with the laparoscope and sit there and cause bleeding and muck and mess, and you just take these plant enzymes and it breaks down these adhesions and the cysts to capsules, so the parasite cleanse can go in and kill them. And I used the enzymes when I did, actually I was using a zapper at the time I did my first few parasite cleanses, and then I prayed because the zapper was kind of weird. I just didn't feel like it was killing parasites, because DC currents, DC means direct current. AC currents is an alternating current, and it's a wave. And alternating currents kill life very easily. Like if you stuck your finger in the light socket, you'd get hurt really bad, burned really bad. But if you do it with a DC current, you'll just feel the current, the energy, and it usually won't cause you harm. And Hulda Clark was using a 9-volt zapper that was a DC current, and she said it helped kill the parasites. Well, I came to find out that through the intuition and through a lot of study, that all it did was make the parasites more active so that they'd move out of these cysts outside of the adhesions. And that way the black walnut, wormwood, and cloves get to them easier. And by using the enzymes, because I thought, there's got to be something to dissolve these membranes, dissolve these cysts. And so I started using the enzymes, and sure enough, it worked. And it would dissolve all the adhesions, all the cysts.
So you don't like the zapper? Does it need to be more than 9 volts?
I don't like the zapper because you have to sit there and use it, and it really doesn't even kill the parasites. It just makes them more active. So if you're not using the parasite cleanse, you're actually spreading them by using the zapper. Because a lot of people, they just use, the Rife machine for parasites or the zapper. And let me tell you, I think it spreads them. Because I have found people don't get well just by using the Rife machine with parasites or the zapper.
Zapper cause harm to your body?
I think if you're not doing the parasite cleanse, it just spreads the parasites.
But it doesn't affect tissues?
I don't think it hurts the tissues at all. It's just a DC current. And let me tell you, like the foot detox, it just uses a DC current through the array, and it just opens things up.
So it's not that? So you don't like the thing either?
Oh, I love it.
Oh, okay.
But let me tell you, if you've got parasites and you're using that, you could be spreading them just by using that DC current. So I recommend people, if you've got parasites and you're using a DC current, make sure you're taking the herbs to kill them, because they can get in your bloodstream and get spread.
So it's okay then to use the foot bath while you're using
Absolutely. Fact is, I recommend it because when the parasites are dying, they release their toxins, and you got to help your body get those toxins out. And the foot bath actually helps remove toxins, remove heavy metals, those kind of things. Parasites take on some of our heavy metal load. They're toxic. They're low vibrating. They love toxic things. They fill their bodies with toxic things. They even carry bad bacteria, bad viruses, bad fungus in their bodies. And when you kill them, boom, it releases them. And one of the reasons I follow parasite cleanses with anti-fungals and antivirals and sometimes antibacterials is because you got to get rid of that crap that the parasites release.
If you have heavy metals, parasites will go crazy?
They love heavy metals. Yeah, they love heavy metals. They take on some of the heavy metal load, which actually helps us in some ways, but when you kill them, they release it. And so that's why a lot of people, they get kind of sick. And so, I'll put them on liver cleanse. The Tetra cleanse is really good. Something to help remove the toxins. And sometimes I'll put them on cleanse and Meta-X to remove the heavy metals. So the treatment is in total congruence with the disease. It's very fascinating. And in 1991, I injured my right hand and stopped doing surgery for endometriosis. But I continued to treat people with parasite cleansing because I found it was very effective. And people would hear about me and know that I used to do gynecology, and they'd be infertile. Literally, these women would be totally infertile. They would come into me, we'd put them on parasite cleansing with the enzymes and the Tetra cleanse and everything, and it was amazing how it would open up their tubes, their ovaries, and they would get pregnant. I also did chelation. My most remarkable story was a 57-year-old woman from Tokerville. Came down. She'd had a dream that she was supposed to have another baby, and she had heard about me. And she came in. She says, I dream I'm supposed to have a 13th baby. What am I supposed to do? Intuitively, I got that she was supposed to do 8 chelation therapies and do parasite cleansing at least 5 times, and do the chelation, once a week, And so anyway, she came in on the 8th for the 8th chelation. She said to me, I think I'm pregnant.
57?
57 years old. She hadn't had a period in 8 years.
Oh, did she start having, or no, she just got pregnant?
She had no period, but she was pregnant. So, what was interesting about that whole thing, and she had a happy, healthy baby, believe it or not, at 57. You know, everybody freaks out they're going to have, you know, mongoloid, you know, Down syndrome or some trisomy, something wrong with the baby because all the doctors are freaking them out. And I think the doctors freaking them out actually produces that because they start believing it. And when you believe something, it creates it. But anyway, when I was doing this, I told her, love your baby, know that it's perfect, know that its genetics are perfect, and just bring this baby in. Because she saw a little blonde girl in her dream and just knew she was supposed to have this kid. And anyway, ended up having the baby at 58 years old. Now, the oldest person I delivered myself personally was a 63-year-old in St. Louis.
Was she an Indian?
No, she was a white lady and lived out in the country, and she was pretty healthy. She looked pretty robust for 63. And so it was quite interesting that she got pregnant in the first place. I mean, her
Nobody
youngest...
helped her, she just got it?
Yeah, she just spontaneously got pregnant, and we delivered her because she was so high risk, being 63 years old. You know, everybody said, oh, gee, it's too old to have a baby. But if you think about Sarah...
Yeah, but they live to be 800 years old.
That's right. And our bodies are actually built to live a lot longer than what we do. And we've come under the belief system we have to die at a very young age. So anyway, endometriosis is quite interesting. So I recommend, if you've got endometriosis, it's parasites. And I would put both the husband and wife on this. Because I found over the years, if we don't treat the husband, he'll reinfect the wife, and she'll come back down with endometriosis again. So treating the husband is very, very important, or any partner. We have to add that. Alternative treatment is using the provermifuge and the rascal. I would still add the wormwood just because I feel like wormwood is very, very powerful for killing the bugs that cause endometriosis. So it's a little different. You use the provermifuge with the rascal and the wormwood with plant enzymes, tetracleanse. Now, a lot of times I'll switch the liver thing depending on the person. We've used liver vitality and another one here that we don't have any called Livenu. Sometimes we'll use this total cleanse. The total cleanse is interesting. It's actually tetracleanse, but it's in a bottle that has 120 capsules versus just the 60. And you take 4 at bedtime of this. This has enough for both the husband and wife, so if I've got 2 people, I'll put them on that. That's my whole reasoning. It's the same thing as the tetracleanse. Okay, except it's, you know, more capsules. Anybody have any questions?
I've got one.
Go ahead.
My mother always told me that endometriosis ran in our family. That Grandma got her, we laid her down, you know, she had
Yes.
a baby in late life, and my mother got it.
Yes.
My girls have had it, my sister had it. If I did, you'd never know because I had a dozen kids. But
Yeah.
But the reason it was being genetic is because of the parasites going from mother to daughter?
Yes, absolutely, because the parasites are up inside the reproductive system and they get transmitted to the babies. They get in the baby system and can cause endometriosis. I believe it's not genetically transferred. I believe it's parasitically transferred. Because the parasites, you know, are there, they're in the uterus, the baby's in the uterus, they get into the baby. And, you know, I've seen girls as young as 9 needing to be treated for endometriosis. I never saw anybody below the age of 9 because most of them, it's a hormonally induced thing, and the parasites don't come out until the hormones start up.
The girls are starting to.
Yeah, and they start to menstruate. Now, they live in that endometrial tissue because it produces a lot of blood, and it produces certain hormones. And the parasites love that, and they get activated with the endometrial tissue. So I believe that's why young girls, younger than 9, and they have to start menstruating. And what's interesting is through the years, endometriosis wasn't as prevalent as it is now, and I believe it's because we've got more parasites and petrochemicals that are causing immune suppression and hormonal stimulation of parasites. Because most petrochemicals have estrogenic effects.
Estrogen in all the food.
Yeah.
Estrogen in the milk they give them in elementary school.
Yeah. They've shown that plastics cause gynecomastia in boys, which means they get boobs. And there's a treatment. Well, I didn't even talk about Lupron. Lupron is a drug that totally negates all the hormones, and they use it to treat endometriosis. And I believe because they suppress the hormones, it suppresses the endometrial tissue, which suppresses the parasites. And so it does work, but at what cost? It's a drug, and it does cause side effects.
They put America on that to try and save, give her a couple more kids down the road, and she didn't ever get her cycles back for, she only had 2 shots.
Yeah.
She was having 4.
Yeah.
And she was only 25 years old, I think.
Yeah.
And she's had nothing but trouble. I mean,
yeah. Lupron causes lots of
yeah,
problems.
horrible stuff.
But it does suppress endometriosis. The minute you go off of it, though, it can come back. And, what is it? There was a drug they were giving boys for ADD. It's on the TV.
I know, that's the one.
Risperidol. Risperidol.
Yeah.
It also stimulates female hormone. It's a mimicker of female hormones, so it made the boys get boobs, and now they're suing the company because...
They gave that to my sister that has Alzheimer's to calm her down, I guess.
Yeah, Risperidol.
And,
it's an antipsychotic.
she was at my house right after an hour or 2 after she'd had it. I thought she was having a heart attack. She was in the hall.
Yeah,
so it affected the...
It's a very powerful drug, a tranquilizer, and it has side effects, and it, can cause problems.
I made her
with
husband
hormones.
look up all the side effects, and I said, "You want to do this to her every day?"
Anybody else have a question? This is a nice short lecture.
Well, I was going to say, what do you attribute? Of course, we probably all know all the infertility nowadays. More women are infertile than ever. The diets.
Well, I have found through all of my work, it's toxins, heavy metals, and parasites that cause infertility. And if you can get those out of a woman's system, which cleans up their system, they get pregnant. I've done it time and time and time again. And, medically speaking, infertility is a major problem, and they think most of it is caused by endometriosis. And yet we would go in with women with infertility and find nothing wrong, except they might have chlamydia, which chlamydia sits in the body and smolders in the tubes and makes adhesions inside the tubes, and you can't see it unless you do what they call a hysterosalpingogram, which is where you inject dye in to see if the tubes are open. And you literally do radiography, x-rays, to watch as this radio-opaque dye goes in, and if it doesn't go out the tubes, the tubes are blocked. And chlamydia is what they call the silent killer, because it's an atypical bacteria. We talked about it a little bit last week about heart disease, and it's a sexually transmitted disease.
Wait, heart disease?
Oh, I believe heart disease can be sexually transmitted through chlamydia, because it's an atypical bacteria. It's one of the ones that can clog up, cause inflammation in the arteries and cause plaques and all of the problems that block everything. And so The treatment for that's totally different. Syphilis is coming back. Gonorrhea is coming back, and those also can scar up the tubes and cause infertility. They can also, syphilis is like, it's called a treponeme, but it's a spirochete. It's a spiral bacteria, just like Lyme's disease is a spiral bacteria. And they can come in multiple forms. These spirochetes can go into a viral form, a bacterial form, a fungal form, and a parasitic form. So I treat syphilis like a multipleomorphic disease, but I also treat Lyme's disease the same way, because they're both spirochetes, and they go in stages. They have a stage 1, stage 2, stage 3, and stage 3 causes neural syphilis. And Lyme's disease, when it gets in the nervous system, it causes neural Lyme's disease. And so, but that's a whole different thing. But I believe both of those can cause infertility.
Why are they
don't necessarily cause endometriosis.
Why are they coming back?
They're coming back because they're sexually transmitted, and in our society, everybody's having sex. It's interesting, a lot of the teenagers don't believe that oral sex is sex, and so they have oral sex, and yet they're still transmitting these diseases. And, when President Clinton said, I never had sex with that woman, it's because he believed sexual intercourse was the only kind of sex. And so, the oral sex was not considered sex to him. Go ahead.
I met up with my cousin yesterday that I haven't seen for 20 years, and she and her sister both, she originally came down, and she got an endometrial clear cancer.
Yes.
That they don't see in the West. I guess they see it back east.
Yes.
And they gave her hysterectomy thinking that would fix it, and it didn't.
No. Because it probably got outside the uterus.
Yeah. Her sister had the same treatment, and she seems to be okay, but my cousin has come down with type 1 diabetes at 60 years old.
Flukes.
You name it, this girl's got it.
It's a parasite called a fluke, pancreatic fluke. Gets in there, eats up the insulin-producing cells. When it eats the last one, you're insulin dependent.
Well, but it all started with this unseen cancer, and she's not responding very well to treatment.
A lot of people think endometriosis is a type of cancer because it grows and it spreads, and it causes damage to the organs. And as I've treated this, think about it. I treated my cancer with this same stuff, and it cured it. And so, I can say cured because it did cure mine.
Why would they have it back east and we wouldn't have it here? I don't understand.
Back east, they have a lot more Lyme's disease, but it has spread to the west. And we're seeing more and more cases of Lyme's disease here. And Lyme's goes into a parasitic form, which I believe can cause cancer. Because more and more people are getting cancers. Cancer is a combination of parasites, fungus, virus, and toxins. And so you get that combination, you get cancer. So that's why I treat a lot of people with parasite cleansing, detoxing. It's because the more you get these critters out of your body, the less likely you are to have disease and have problems. And they sap our energy. They take our energy away. They stick their little tentacles into our body, and they suck our cytoplasm and cause a lot of problems with the organs. I'm going to talk a little bit about viruses next week. And the interesting thing about viruses, certain viruses gravitate toward certain organs. And like adenovirus, adeno means glandular virus. Why did they name it that? Because it goes and affects all the glands. And then, Epstein-Barr was found to gravitate towards the lymphocytes. Cytomegalovirus was found to gravitate towards monocytes. And both of them cause leukemia and lymphoma. So it caused cancers that involve what they gravitate towards, and they infect all the cells, and that's when you get cancer.
I think,
kind of interesting.
I just think everybody should start with parasite and yeast cleanses for a while and see what happens to their other diseases.
I agree. And test with kinesiology. Ask if there's viruses or bad bacteria, because if you kill those parasites off and they're releasing this bad stuff and it overwhelms our immune system, it can cause worse problems. So I always do the parasite cleanse. And one of the reasons Ola Clark put the black walnut in is black walnut is a very good antibacterial for staph, strep, chlamydia, what's the other one? Clostridia, the one that everybody's really freaking out over because a lot of people are getting this Clostridia from all the antibiotics and it overgrows in the body. And the black walnut actually kills that stuff off. So Ola Clark really put a lot of thought into making the parasite cleanse. A lot of people say to me, oh, can I not take the black walnut? Well, what if they've got the bad bacteria in their system? You kill the parasite, it releases all this bad bacteria, and you kill them off. You kill the person because they get a bad bacteria in their system.
You can't just kill the parasites and expel them.
If they're in your gut. But the problem we're having today is parasites are getting in our system. They're getting in our organs. And it's hard to expel them without using the normal process of breaking them down and having your immune system grab them and take them out. If they're just in your gut, yeah, you could take something real easy and get them out, eliminate them because you're eliminating anyway. But with all of the GMOs, the genetically modified foods, the glutens causing leaky gut, we're actually getting these organisms more and more to our body because our immune systems are down and we're leaking proteins and big molecules and parasites into our system, into our bloodstream, into our lymph, and it's, that's why cancer is so dang prevalent. Monsanto makes most of the chemicals to get rid of, chemotherapy, and they're actually causing us to get more cancers through the chemicals that we're getting in our diet, causing leaky gut and those kind of problems. You know what's really interesting? I'm going to just say this because Spirit's saying we went down to Expo West, which is the biggest nutraceutical Whole Foods expo in the world, down in Anaheim, and there was a doc from Japan who was treating schizophrenia, attention deficit disorder, all kinds of mental problems, including depression, with lion's mane. And lion's mane is a type of fungus that grows and it looks like the mane of a lion. That's why they call it that. And lion's mane has been shown to stop Alzheimer's and reverse it. It's also been shown to be the only substance that has nerve tissue growth factor, so it can regrow your nerves. This guy was 91 years old, and he had been dealing with lion's mane for some 40 years and using it extensively. And he's trying to teach the medical doctors, hey, you can give them this natural substance from lion's mane, and it will reverse, some pretty bad disease.
Does that help with MS?
And MS is a combination of parasites and heavy metals. And so you have to kind of kill the parasites and remove heavy metals to get rid of MS. And most people don't do enough. I did 197 chelation therapies, and my lead level was still high, but at least brought it down in half. My IQ went up by 10 points, which was, that's pretty amazing to have, your system work that much better. Go ahead.
Does the mercury affect, the mercury in our fillings?
Oh yeah, the mercury in your fillings is so highly toxic. The ADA, actually they made the ADA because they knew back in the 1800s how toxic mercury was, because people making hats would use mercury to hold the hats up and put them together, and all of the hat makers would get what they called Mad Hatter's disease, which was mercury toxicity. So even back then, they knew that. And the American Dental Association had a bunch of people coming against the dentists saying, you shouldn't be using mercury fillings. And so what they did was they banded together, made the ADA, and it was a powerful enough force that they didn't have to adhere to any of the things the judges ruled, nothing. And so even today, dentists are still using amalgams, and they have been proven time and time again to be highly toxic. When I was a little kid, we broke a thermometer and there was some mercury rolling around, and I sit there and I rolled it around my hand. Well, there was enough mercury got in my system that I became very ADD when I was young. And when I chelated, it was amazing. I got all that out of my system and I became able to focus much better. I was a highly intelligent kid, but I could not sit and concentrate on anything.
But you have to remove the fillings in order.
Now, it's very toxic. Removing the fillings is a very toxic process. And they have found that when you remove them, you should only do a quarter of the mouth at a time. So the upper left or the upper right, and you should wait at least 6 months in between removing them. Because they have found the levels of mercury go high up, and when they remove it, it actually becomes gaseous, and it's more easily absorbed into your brain. So they've found it's very, you have to go to the right dentist, using the right ventilation.
Dr.
And
Ott across the street does that.
Dr. Who?
Ott, and he puts something off over your throat, inside your mouth.
Oh, good.
So mercury can go down.
Good.
Puts you on a herbal detox.
Yeah, Vicki, my wife, got half of hers removed, and she was sick for 8 months.
And he does that. He puts it on
wow.
and has
Yeah.
a portion.
So be careful if you're having it removed, because it can cause toxicity.
Well, I mean, is it better to remove them though?
Yeah.
Yes, over the long term, yes. They have found people who get them removed do much better. They've actually found that women with more amalgams, the babies are more likely to have problems because they've got so much mercury in their mouth. Now, they have mercury and lead and nickel, all kinds of stuff in amalgams. So there's a lot of different heavy metals. And my good friend was a dentist, and I tried telling him for years, don't put that stuff in my mouth, and he did anyway. And I wanted porcelain or something more inert, but the dentists use it because it's easy. They can manipulate it easy, and but it does cause toxicity in the body. Anyway, thank you for coming today, and we'll post this to the internet as soon as I get it done. That'll be good.